I wasn't getting out of bed.
I wasn't going to work.
I hid my problems from everyone.
I didn't want people to judge me.
I watched my daughter suffering.
I didn't know what to do.
Because you joined the conversation, we know we are not alone.
We are not weak.
We are not ashamed.
We are strong.
And help is out there. We need to ask for it. Join the conversation. Visit letstalkstigma.org.
Hello, I'm Karl Shallowhorn, board member for the Erie County Anti-Stigma Coalition, and on behalf of the coalition, I'd like to welcome you to the 11th in our series of Facebook Live events, this time focusing on the state of stigma, our mental health concerns contributing to healthcare worker burnout. For decades, healthcare workers have faced increasing amounts of stress due to the amounts of demands placed on them by their profession. Everyone from doctors to nurses, behavioral health specialists, home healthcare workers, EMTs, and hospital workers have all been affected. And for the last 2 years, due to the COVID pandemic, there have been more issues that arise for those who are charged with caring for others. This has created a quote-unquote perfect storm for mental health concerns for these workers. In today's discussion, we're going to explore if these concerns are contributing to the rise in healthcare burnout with 3 individuals who have different perspectives on this topic. Before I introduce our panelists, here are a couple of housekeeping rules. Our program is for 1 hour. During this time, if you have a question or comment, please type it in the chat box and we will respond accordingly. Today, I'm joined first by Elizabeth Mauro, Chief Executive Officer of Endeavor Health. Endeavor currently operates 35 different programs and is licensed in the areas of adult mental health, child mental health, alcohol and substance abuse services, and integrated services. Liz is from the Buffalo area and a graduate of the State University of New York at Buffalo's Graduate School of Social Work. She's a founding partner, treasurer, and advisory board member of Value Network IPA, LLC, along with serving on the board of several local and New York State organizations. Liz is the recipient of the 2018 Lifetime Achievement Award by the National Association of Social Workers, New York State Western Division. She's a recipient of a scholarship to Harvard University, John F. Kennedy School of Government Executive Education Program, an adjunct professor at St. Bonaventure University Graduate School of Education, and a past teacher and moderator for the Harvard Business School of Buffalo. Next, we have Shacarah Henry. Shacarah is a clinical supervisor at Horizon Health Services. She graduated from the University of Buffalo with a BA in psychology in 2013 and went on to complete her MA in clinical mental health counseling in 2016 with a focus in co-occurring disorders at the University of San Diego. Shacarah identifies her passion for working with a variety of clinical populations, including co-occurring disorders, perinatal and postpartum women, and trauma. She has training in a variety of interventions, including positive psychology, scheme therapy, dialectical behavioral therapy, cognitive behavioral therapy, mindfulness-based cognitive therapy, perinatal mood and related disorders, and seeking safety. And finally, we have Dan Nelson. Dan is a nurse manager at New Directions Youth and Family Services. Dan volunteers as a paramedic as well as a lieutenant firefighter for the Falconer Fire Department. He received his RN degree from Jamestown Community College. He's also had extensive experience working in a local hospital emergency room. Welcome everyone to today's discussion. So I want to just thank you again for taking the time to be with us. So I'm going to begin with a question for everyone. From your perspective, so what's been the change for healthcare workers in the last couple of years because of COVID? Aside from the obvious experience of increase in patient numbers, so what's changed? Let's start maybe with Liz. For you, in the behavioral health world, what do you see as the changes?
I think first and foremost is the increased awareness of the importance of mental health and emotional health and stress and trauma and how that can collectively build, and then how much more deliberate attention needs to be paid in addressing it for ourselves as caregivers, as healers, as people working in the health field, just that you have to, it doesn't just come, you can't just fill your cup, so to speak, just through your natural day-to-day activities. You have to take that particular time to do it. So that's been a thing. And then also probably more reach outs from other healthcare systems to our field, to behavioral health, than I've ever seen before. Just asking for help for their workforce in general, as well as tips and things to help support them.
And how about you, Dan? What changes have you seen?
There's been an extensive amount of changes within the healthcare field itself. COVID brought about a bunch of new ways of having to treat people, a lot of different aspects of preparedness that we needed to do. It brought out a huge kind of area that we always have trained for, but never have really had to implement until this happened. Like you said in the beginning, the amount of patients obviously increased as well. But the fact of the mental toll that it took on not only the healthcare workers, but the patients as well. I mean, it's hard to take care of somebody when you're behind all of the PPE that you have to wear for that. It's hard to get those patient to nurse bonds that are so important within coming to take care of somebody.
And of course, Shacarah, you're I would say more on the front lines as a clinical supervisor at Horizon. So in your experience, what have you seen as far as the changes?
Yeah, I think that there's been a lot of change. And at the same time, I think there's some aspects that have not. I think with the change, we've definitely seen a lot more of a diverse population of clients coming in through the door, not just ones with severe mental health or substance use challenges, but people that I think never even thought about needing or wanting treatment before in this capacity. So we've definitely seen a lot more a diverse population. Access to care has gotten a lot easier as well with telehealth services. So that has brought more people in the door who maybe could not normally, maybe they didn't have a clinic close to them or something like that before. So now they have this alternative means of getting the support that they need. So some really good things, because we want people coming in, we want people getting help to address issues that have come up. I think that what we have noticed hasn't really changed is that we're still severely under represented, undervalued, underfunded as organizations. And more awareness has been brought to the importance of behavioral health treatment. But the other stuff that we really need to provide the best care for the most people at one time, unfortunately, hasn't really met up with the demand that we're seeing. So I would say that hasn't fully changed, even with COVID. The awareness definitely, which is good. So hopefully we can move in the right direction with that.
So I want to throw something actually based on that back to Liz. And then really at an administrative level, of course, this is a related topic, but Governor Hochul has talked about putting more money into behavioral health, and with the recognition that more services are needed. What are your feelings about that? Obviously, I'm sure you like that, but what are your thoughts?
Yes, I think it's one of the most promising state budgets we've seen in well over a decade. So I think that's great. My concern is it's still not enough to catch up for all the years of deficits, and how will it be ongoing, right? So it's that proactive sense of how do we continue to recruit and retain skilled workforce and properly support them so that they have a decent living wage. So it's a start, and that's wonderful, but if it's not built into the rates and it's not ongoing with ongoing increases, then it's just a one-time infusion, which we'll take. Don't get me wrong, we'll take it, but need more.
But I mean, yeah, you're right. That's that idea of the one shot in the arm kind of thing. No pun intended, but it's like one shot in the arm, and then what do you do to keep it going? And I think, of course, right now we're in a state where so many people have been affected that this isn't going to be 1 year. Of course, mental health goes on for people's lifetimes, and we're going to be seeing this for years to come. So we will need this continued advocacy and leadership to see it forward. So that's a great point. That's a really excellent point there. So now I want to go back to you again, Liz, as far as the support and emotional well-being of your workers. So what are you seeing the needs there for them as far as specifically, because actually Shacarah just kind of made a mention, and I think you made a mention too, of the idea of the workers and their own needs, having them supported. What would you say in that respect?
It's all of it. It's so much more of an increased need, so that as an employer and supporting our own healthcare workforce, we've created a wellness program out of necessity over the past 2 years. That's way more intensive than we would have ever had before. We used to do wellness days and things like that, but it wasn't like what it is now. So I think it's that deliberate realizing that folks are short, everyone's short staffed, so caseloads are higher. The number of deaths is astronomical. So there's this collective trauma and grief that everyone is experiencing. And then to support our workforces, we've worked out like different arrangements with other agencies, like for EAP services, for very private kind of support and help in terms of counseling, had conversations, screening tools, focusing on emotional wellness. And it's almost like this little light bulb goes on of like, oh, I'm working so hard to help everyone else with their depression, anxiety, and trauma. And guess what? I have it too. And sometimes it's hard to recognize it in yourself, and asking people to stop. It's almost, as employers, we often didn't, there was like a boundary there that you didn't go there. You waited for people to come to you, but we rose awareness of saying, you're probably experiencing these things, and here's how we might be able to help support you.
Yeah, it's so funny, Liz. I mean, I have the experience too. I've worked as a clinician in the past. And then, of course, people think that just because you're doing this work that you've got it all together and that you're perfectly suited and that, no problems. Well, yeah, I mean, they experience as much as anybody else. In fact, doing that kind of work can be very challenging in that you're bearing other people's burdens, so to speak. You're hearing other people's stories, and we hear this term vicarious trauma, secondary trauma, that can really affect a person in a way that, we talk about burnout can happen and compassion fatigue. So absolutely. Dan, so for yourself, you've worked in an emergency room. You know firsthand what it's like to see cases of people coming in. And so have you, what was like, did you feel overwhelmed at times? How did you experience it?
Absolutely. The world of nursing has changed as we know it. The world of nursing has always been a extraordinary group to be involved in, and this has just brought us closer together as nurses to help kind of each other in regards to this. It's not very fun when you talk about secondary trauma. That's what the nurses are dealing with. They're a lot of times in the beginning of this pandemic, they were that patient's their support system. They were the ones holding their hands when they were taking their last breaths. They were the ones that were there with their family, trying to console not only the patient who's they're trying to take care of and keep alive, but the family that they're dealing with through Zooms or on the phone. And it takes a huge toll on you. Personally, in my area, we have a smaller hospital, so our patient ratio is pretty big. Same thing working at New Directions, where we have all these adolescent youth here that, I got to be in constant communication with their moms and their dads, let them know what's going on with COVID. It takes a toll on you as a nurse, would take a toll on anybody. So the importance of us being self-aware as nurses, to go and reach out to our different outlets that we have is very important, for any company to make sure that they have lots of outlets for these nurses that are on the front lines working with these patients, being that, in a lot of essence, that last person they talk to.
That's a really great statement. In fact, I learned something a while ago when I was doing some research about compassion fatigue and secondary trauma. But compassion fatigue was actually came up from nurses years ago. That was where they really came up with the idea that people do experience these feelings of serving and helping others and bearing these burdens, and having that idea of being overwhelmed and not knowing how to manage. So I think, Dan, you talk about your case working in a hospital. It can be really critical to know how to manage these things. I do want to just mention to our audience, if you have a question, please feel free to type it into the comments box, and we'll try to address it. We do have one question that just came in. It asks, does the culture in healthcare help or hinder self-care? And a follow-up, what is the role of the general personality profile of people who seek out this kind of work? So let's talk about the first one. So Shacarah, what do you think? Does the culture in healthcare help or hinder self-care?
I think that, and, this is something that we definitely think about a lot, especially now that I'm a supervisor, think about a lot. I know as kind of behavioral health professionals, we learn to compartmentalize very well. and really kind of put ourselves in a different box than the people that we're working with so that we can do our jobs effectively. But the nature of what we do, it's so difficult. It's made even more difficult to do our jobs if we're not engaging in self-care. So I think it has to be really intentional from the management staff and like senior management at different companies to really be incorporating opportunities for wellness, kind of like Liz was mentioning before. Because if not, some of us don't feel like we have the time or the space to engage in self-care at work or even afterwards. We get done with work and we're so exhausted that all we want to do is just kind of sit down and lay on the couch. And sometimes that's what we need. And other times we know that that's not us actually taking care of ourselves. That's us literally just laying there in exhaustion. So I think that the culture of healthcare can make it difficult to have self-care and practice self-care, but I don't think that it's impossible if it's being encouraged and we're empowering our staff to take care of themselves and giving them the space to do that.
Mm. And I had to actually add one other word. I used to remind myself all the time is to be intentional.
Yes.
To practice what we preach, right? So often we're telling people to take care of themselves. We have to do the same thing. So, so Dan, what about you? From your perspective, how would you respond to that? As far as does the culture of your world, does it help or hinder self-care?
It absolutely hinders it. You're supposed to be that strong, supportive person when you're taking care of anybody, and you can't really allow your emotions to take over. When you're taking care of that person, or when you're that last person on the phone with their family member as they're taking their last breath during COVID and they couldn't be with them, you absolutely, it hinders us because we were expected to just kind of pull up our pants and keep going and make sure that our next patient that is right behind this first one is just as taken care of as the last person. So it absolutely hinders in our world.
And Liz, how about you? What do you think?
Yeah, sadly, I would agree with that. I think you have to kind of push it on healthcare providers and build it into the workday and not let them wiggle out of it. Because otherwise it does become that like, no, I got it. I'm the healer. I'm the helper. And then they put themselves last kind of consistently. And the notion of strength becomes a little bit mixed up. So I think this has certainly raised that awareness of we have to basically practice what we preach.
So let's look at another question. It says, what is the role of the general personality profile of people who seek out this kind of work? So once again, Liz, you've been doing this a long time. I don't mean to date you here, but you have. So as far as the people that you've seen over the years who do this kind of work, we talk about personality profile. I guess we would use the word. What are the characteristics of the people who want to be, be helpers?
They're usually very empathic. They're problem solvers. Generally, very bright people, warm, all kinds of wonderful traits. I have some that have a more of a curiosity-seeking mind. So they're the conveners, right? They're the joiners. They're the one that bring everyone together and seek out those strengths and like to build up others. And again, they often tend to put themselves last. Very, very emotionally strong people, kind of a thing. And again, if I were to look at COVID and where we're at now, it's a marathon. So it's not something you're going to power through. So it's really how to pace yourself. And I think that's where many healthcare professionals hit that wall because they're like, I got this. But see, it's not ending. We're still in. So it's that marathon kind of pace. But generally very kind, very, very competent people.
Yeah. And of course, I think one thing that you use the word empathetic. I think that is essential, of course, to being in the field. If you don't have empathy for others, you're in the wrong business, right? So that's the thing to consider. Shacarah, I want to go back to you with the idea of feeling overwhelmed and your experience. Of course, you are, in a sense, compared to, of course, Liz, you're newer to the field, but you've been doing this for several years. What about 6 or 7 years? In your experience, have you felt overwhelmed at times, or how do you handle it, and what do you do when you feel that way?
Yeah, absolutely. I think that if anyone tries to say that they have not felt overwhelmed while working in this field, they're lying because it happens and it's such a normal part of what we do, is that we're going to get overwhelmed. We are the holders of the world's problems, but we're also charged with helping people to overcome challenges that they're experiencing. So it only kind of is natural that at times we would become very overwhelmed. Like I said, we learn to compartmentalize really well, which in some senses probably seems like a good thing, but it can be so detrimental. We experience vicarious trauma on a daily basis. Most professionals do in the behavioral healthcare world, because of how much we hold on to. And speaking to what we were just talking about, we put ourselves last, right? Like that is what Liz mentioned, is that we put ourselves behind everyone and everything else in an effort to try and be our best and do our best for the people that we're working with. And that's really great. And it is a disservice to us as well, which is why we're seeing so much burnout and compassion fatigue and people leaving the field because they just can't do it anymore. And COVID has definitely exacerbated that. And so we have to figure out ways to make it easier for our staff to do the work that we do and maintain that, really make it a sustainable work environment. I think something I want to kind of add to that too, that I wasn't thinking about initially, but because of the stigma of obtaining treatment services, I think that also makes our job more difficult. And then also because of the roles that we play in our work life, that means that people in our personal lives tend to lean towards us and ask us for more support in these ways because they know what we do. And so our job doesn't end when we leave the building. So I think that absolutely adds to the difficulty and sometimes why mental health professionals, behavioral health professionals can get so overwhelmed, because it's like, this is our life 24/7. Sometimes it feels like.
Yeah. I actually want to do a little quick follow-up, Shacarah, so our viewers get a better comprehension of the term. We use that term vicarious trauma, compassion fatigue, secondary trauma. How would you define those terms so everyone knows what we're talking about?
Yeah, no, for sure. Vicarious trauma. So essentially that secondary trauma that healthcare professionals can experience, and not just healthcare professionals, but since that's what we're talking about, can experience because of the stories that we're hearing from the people that we're working with. So their real actual experience of trauma, sharing it with us and sharing kind of the full intensity and brevity of that trauma. It can lead to us as professionals experiencing that secondary trauma from hearing these stories. Compassion fatigue essentially is just you kind of start running out of that empathy that you have so much of because you're giving out so much of that all the time. And so you're essentially just getting tired, mentally tired, which then, kind of causes us to be physically tired. We actually do a training here at Horizon. I'm one of the facilitators of that on compassion fatigue specifically and interventions to help manage that before it leads to burnout, which burnout is essentially when people just feel like it's just too much and they can't really do it anymore. And that is what we see is the end result of people leaving the profession, even just temporarily, because they have gotten to that state of burnout where they just can't muster up the energy and the empathy and, the compassion that we need to be able to do this work.
Thank you. That's the great explanation. Great answers there, Shacarah. Appreciate it. If you're just tuning in, I'm Karl Shallowhorn from the Erie County Anti-Stigma Coalition, and I'm joined by Elizabeth Mauro, the Executive Director of Endeavor Health Services, Shacarah Henry, Clinical Supervisor for Horizon Health Services, and Dan Nelson, Nursing Manager for New Directions Youth and Family Services. So I do have a question that came through. If you have a question, please feel free to type it into the chat box. You can visit our website at letstalkstigma.org to take the pledge to end stigma. Also, if you're connected with a business, organization, or faith community, you can become an organization member of the Anti-Stigma Coalition. You can find information for this on the website under the Members tab. So our next question is from the audience. How do you think the healthcare system can make intentional time of practice to check in on the healthcare workers? So, Liz, you kind of referenced this a little bit earlier, but what do you think you would say as far as what you can do to be more intentional? healthcare workers?
I think building it right into your practice, right into your policy and procedures so that it just becomes normalized. And also it's not an optional thing. It's just a required thing. So anytime, and we started to do this years ago, and it made a huge difference of anytime there's a tragedy or an incident, it's all the staff that work with that person. We have a whole collective wide meeting. And then after, we have our EAP counselors available for folks to use. And it's in the middle of the workday. Folks are paid and it's scheduled into their calendar. It's not allowed to be overridden with, the other competing demands. And at first, people are like, no, I don't need to talk to anybody. I don't want to press. I don't want to this and that. And now it becomes one of the most valued things that staff say that it really helps them. There's just, again, vicarious trauma, there's guilt, there's the stress and anxiety. So it's building it in. And then we've also just built right in and made it mandatory for everyone to go to of literally health and wellness activities. And so it could be, we'll do a variety of things, guided meditation. We did a whole retreat where we walked around in the woods and did fun things and team built. It's just building it in and making it a part of the workday, because too many people otherwise will be like, nah, I'm going to stay back and do paperwork, or I have to squeeze in a few more clients. It's like, no. This is a required staff meeting, and we're actually just, and it's not, again, getting into people's personal stuff, but it's building up those skills and taking the time to do it. And then we also brought in, we've been doing it twice a year, where it's just through our EAP because of the privacy, because we have our own stigma attached, right? And Western New York's small. So where do the providers go, right? It's probably someone they know. So trying to build in folks that might not know them from other parts of their life or isn't a colleague in another setting, that becomes very challenging. So trying to bring in folks that are maybe new to the area, and then having it that it's just very confidential, that folks can just schedule a half hour in the middle of the workday to just talk.
That's excellent. And once again, I used the word intentional before, but that's really a lot of what we're talking about here is being intentional. Dan, from your perspective, what would you say healthcare system can make, as far as intentional practices to check in on their healthcare workers?
For sure. Definitely within each's organization, just like Liz was saying, the policies kind of work it right into that policy. As a nurse manager, that's something I have to be aware of all of my staff, every single nurse that works under me, every staff that's under me, like in New Directions, our youth support specialists. We have to make sure that we're staying on top of that so that we're paying attention to any of their potential red flags that are coming up so that we can get involved. Same thing goes a lot of places. I know New Directions there's different organizations that you can use as a company for outlets so that you can have your nurses or your workers contact them if they're struggling with anything, so that they can be in contact with a mental health counselor. They can kind of get that guidance and that direction as to what they need to do when they are having these moments of, complete stress and compassion fatigue and, ready to throw the towel in. Before they throw the towel in, let's get through these steps. And that goes back to your manager, making sure that manager is staying on top of the employees as much as they can, especially within times like this. COVID can play a huge role in a lot of things. And it's one more step that nurse manager or any manager for that sake needs to make sure that they're staying on top of their employees. As soon as they see any type of a red flag or anything, a little hiccup in the road, that they get that person and they pull them aside.
So Dan, to follow up quickly, what would be some of the red flags that you'd look for, that you would advise your managers to look for, or what managers to look for?
Definitely, when it comes to that compassion fatigue, if you can see that person in nursing, especially, that they're just usually the most upfront, compassionate person ever, and all of a sudden they're just starting to not even care. They just walk around with their head down. They seem tired. They're overtired. A lot of times, if you can tell, unfortunately, alcohol is an escape for a lot of healthcare workers. If you can see that, you can smell that, you try to help them as best as you can to pay attention to everything, and just watch for any of the little subtle things that can happen in body language, especially.
Nice. Shacarah, I want to ask you, as far as what kind of advice do you have for the loved one? This came from an audience. What kind of advice do you have for the loved one of a healthcare worker, and what should we look for? How can we help?
Yeah. We work with a lot of family members here and loved ones. It's a really big part of the work that we do. And I think that the best advice that I could give is just allow space. allow space for your loved one to be able to talk and sometimes just be, right? Like just letting them know that you're there for support if needed. And I am always going to recommend that anyone in the healthcare field gets their own therapist or counselor to speak with, whether they're in behavioral health or like medical, because we need an outlet. We need someone to be able to speak with. And Liz did mention, right, like it's not a big population in Buffalo of therapists, and so it can feel uncomfortable to say like I need one, but I don't want to go to someone that I might know in another capacity that maybe I've connected with through work or kind of networked with at some type of program. And so I do think, again, this is where the access to telehealth services has actually been really awesome, because you could get a therapist that's not in your specific vicinity, right? Like that is not in Buffalo, and still have access to that support without feeling like you might be putting yourself in a position where there's that kind of dual relationship and you're not really sure what to do with it. So my best advice is just to offer that space and support if the person needs it. Let them come to you once you kind of offered this space out. And then obviously kind of that secondary recommendation being, get yourself someone to talk to. It's okay to do that. We don't have to keep putting ourselves at the back of the, at the back of the bus in front of, behind everybody else.
So as a follow-up to that, so I know Dan talked about the things to look for in the work setting. Shacarah, what about at home? You said you work with a lot of families. What should they be looking for at home? Because, of course, people present themselves differently than they do in the workplace.
Yes, no, absolutely. And this is where that compartmentalizing can be like really detrimental if you're not paying attention. But, when you're actually paying attention, you are going to notice changes in people's behaviors and the way that they're talking, similar to how we would maybe as managers at work noticing those things. But as family members, we actually have a more keen ability to do that, kind of more of an intuition as well that's included because we see these people more often. We might know them more intimately than obviously we do maybe some of our staff members. So I would say like changes in behavior, like maybe they were super outgoing and they did a lot of things and now maybe they're isolating. Maybe they are spending more time just kind of watching TV on the couch, maybe just kind of like mindlessly on their phone. Dan brought up alcohol, other drugs. Those are foolproof signs to know that something has changed. If maybe they were a social drinker before and now they're drinking more often. I had a relative who, kind of openly admitted a little bit later, but was able to get to the place where they said, like, I was drinking every day. I wasn't drinking to the point that I was drunk, but I was drinking every day. And that was very much not like her to do that. So that's kind of that behavioral side. And then I think on the other side, you always want to make sure that you're paying attention to any thoughts, like any like verbal communication that might indicate thoughts of suicide, especially where maybe they weren't, kind of saying those things before, but like down, depressed, hopeless, like those types of things come out in people's verbiage, sometimes even without their knowledge. And so those are definitely things to pay attention for as loved ones. And not be afraid to take action if you're very concerned, because I've worked with a lot of people who said that they thought something was going on with their loved one, but they didn't do anything about it because they thought to themselves, well, they'll tell me if something's going on. Well, they won't. And especially healthcare workers who are used to just do it, right? Like, let's just do it and we're doing it and everything's fine. We are more likely to minimize what's going on for us than other people are. And so we have to take that next step if we feel like it's necessary.
I'll tell you, this is a great discussion we're having here, folks. I really appreciate all these wonderful answers. I hope the audience is too. I have another question for everyone. We're here, of course, to talk about stigma and how stigma affects those in the healthcare field. So in the settings that you work in, how has stigma affected the workers? We talked a little bit about how the idea of not seeking help because of being a fear of what others might see or might say. But specifically, Liz, what have you seen as far as stigmas for those in your workplace?
I think it is, again, the fear of a lack of privacy. So there's that of maybe being judged, their own self-judgment or judgment from others. So stigma gets into it that way. I think it doesn't fit with people's self-perceived notion of that I'm here to help others, and so I don't need help, and more that we can move beyond that kind of thought process, that emotional wellness is just something that we all need, psychological wellness, and that we all would be working on it, no different than nutrition or anything else. So I think the stigma gets in the way of it, and it's sometimes in a more subtle, layered way, especially with healthcare workforce.
Dan, how about you?
That's a good question. As nurses, we do a lot of that inner personalizing everything. And big thing with nursing is you don't want to let anybody know that you're struggling, because you don't want everybody to talk peer pressure. You think, oh, it's just high school. No, it continues throughout life. And you have that fear of somebody telling you, oh, well, you couldn't hack it, so you had to, you have to go somewhere else. You're not a strong team member because you couldn't help. That's a big thing with nursing, is that we don't ever want to let each other down. And you do get that sense when you feel like you are at that burnout stage where you're going to let your partners down. You're going to let them down, and realizing that you just can't do it right now. You need to take some time for yourself. It's hard. It's hard in the nursing world to be able to accept that and move on.
Thank you. And then Shacarah, how about you? I know you mentioned a little bit before about mental health or behavioral health workers who might be afraid to seek help from others in the area. But anything else you want to add to that?
Yeah, absolutely. I mean, I definitely agree with both Liz and Dan, their responses on this. And I think the biggest thing is minimization, again, is minimizing, because then what does it mean if we're struggling as healthcare workers? Does that mean that we can't do our jobs? Does that mean, like Dan said, are we, we're at that point, so we're going to let our team down, because we are very kind of team oriented. I would say that's another hallmark of the personality of most people that go into this field, is wanting to work together and work as a team. And so one of the worst things you could potentially feel is that I'm going to let my team down and I can't do my job because of what's going on. So it leads people to avoiding seeking their own services and just kind of pushing things further down in an effort to meet the needs of the team, meet the needs of their clients, which then obviously we know doesn't actually work, right? Then everything explodes out of someone, and then they actually need more services and more support than they might have needed if we were just addressing it at the beginning. And so I do think that's a big piece of it. I think just like speaking to, I mentioned it a little bit earlier, just kind of the impact of stigma around mental health and the impact on us as healthcare workers, that makes the intensity and severity a lot of times of the clients coming in more difficult to manage, because they are experiencing their own stigma about seeking services. So they don't, or they avoid talking about their problems. And then those problems essentially, kind of just increase and increase and increase, and they become this major issue. So I think stigma hits on both sides in like so many different ways that it's kind of unbelievable how much the stigma has such an impact on this whole field of healthcare.
That's once again, great, insightful comments from all our panelists. I do want to remind everyone, if you're just tuning in, I'm Karl Shallowhorn from the Erie County Anti-Stigma Coalition. I'm joined by Liz Mauro, Executive Director of Endeavor Health Services, Shacarah Henry, Clinical Supervisor for Horizon Health Services, and Dan Nelson, Nursing Manager for New Directions Youth and Family Services. Remember, you can visit our website at letstalkstigma.org to take the pledge to end stigma. Also, if you're connected with a business, organization, or faith community, you can become an organizational member by going to the Members tab and find out information there as well. You can also take the pledge. Remember, take the pledge to end stigma. So I do want to go back to all of you and ask the question about resources. We talked a lot about some of the concerns and challenges. What about resources for those in your field, your respective fields? Dan, I want to start with you because you're a manager, and I want to ask, where do you refer people?
So within New Directions, we use a company that we have that has all those resources for us. They have the ability to contact a social worker if you need to talk to them. They have the ability to talk to you about anything you need. We have those flyers posted through our entire facility. especially one in our office here in the health services office. So that way, all the employees know that they can just come and look at it. They don't have to be judged because they're not going to the one place that it's at. We post it everywhere so that way they can look at it if they're going to the bathroom. They can look at it when they come into work to take their temperatures in the morning now. Making sure that they don't feel that they're under a microscope, that, if they're going to do that, everybody in the world's going to find out that they're going to call this hotline. It's going to help them deal with some of what they got going on. So it's just it's a phone number. It's a simple thing that we do here. Keep it as simple as you can, kind of a thing.
Thanks. And so, Liz, you care to add any more about EAP services?
Yeah, I think, advertising that more, and we created a landing page, right, through where our online payroll system goes so staff would see it. So it's just a click, and then it has all the different resources that are there, which are really helpful. And so folks get that very confidential, and they get 3 kind of more telehealth kind of consultation or mental health wellness visits. And then also working on, and which we just launched a face-to-face kind of live counseling, very confidential. We call it like an administrative kind of thing to get folks to a counselor who's well-versed in the field as needed. Makes a huge difference. And then we also implemented My Strength, which is an app, which is for anybody. So it could be for someone seeking services, but also for staff. And we've got really good feedback on that because it can go on their phone. It can be for their family members and children and everything, but it does like daily journals and all kinds of great articles and videos on meditation and all of that. So we really encouraged everyone to have that on their phone. There's just some great tips and skills and techniques. And again, very private.
Excellent. Thank you. I'm gonna shift gears real quick because I know we've got some few questions coming in that I want to address from our audience. So, Shacarah, I'm going to address this with you. I asked you this one. What can be done to help? Actually, no. I just realized it just moved on me. So, what can be done to? Let's see. Oh no, here it is. Is there fear of maybe not getting a promotion because there may be a perception of not being able to handle stress? That's a good question.
That is a good question. I want to say that I hope not. But again, I think that goes back to who you're working for and kind of like what the culture is of the company that you're working for. If you have to be afraid that you struggling means that you can't get promoted, that's just ridiculous. Like, I mean, that's just kind of one of the most ridiculous things that I've heard. Like, that should not be a fear of a healthcare worker. And I'm not saying that it's not. Like, I'm not trying to minimize that. I'm sure a lot of people feel that way. But if our like kind of leaders in our companies are not aware of the difficulty of the work that we do, and then that will potentially lead to challenges, then I'm not even sure how to talk about that or even where to begin. I have struggled. I was promoted to clinical supervisor. That like, because I had a management team that understood and was able to work with me and were able to work with our staff to overcome the struggles in an appropriate way. And that doesn't get in the way of them doing their job. So if we put more intention and effort into staff wellness, it actually allows us to be more present. It allows us to be better at our jobs. And so then we don't have to worry about that. So struggling should not be equated to whether you're good at your job or not.
Great. That's wonderful. And so I think the whole idea we're talking about here, and I'm getting a pretty clear message that each one of you in your respective roles at your organizations try to support your staff as best as possible so they can do the best job they can, but also take care of themselves. Because as we say, and I think someone said it before, you can't pour from an empty cup, right? I've heard that saying many times. So we want to let our viewers know that. So Dan, I want to ask you another question from the audience, another good one. What can be done to help new nurses as they enter the field, maybe add into this curriculum that they are learning about in terms of just understanding what to look for and how to better take care of themselves? What do you think they can do? And then I'll follow up also maybe with Liz in terms of behavioral health. But for nurses, what would you say?
For nurses, it's super important that we teach during nursing school that the field in itself is a very stressful field, and make sure that they're very aware of compassion fatigue and secondary trauma, like really drill through during those nursing schools, which I know they are doing, especially now. giving the nurses the tools that they have and the knowledge that they have to be able to identify themselves so they don't get to that burnout level. We all eventually end up with a little bit of burnout, but if you can give the tools and the necessity for a nurse or anybody for that matter to understand and be able to self-realize what's going on and let them know that they're not in it alone, that this happens all the time. It's a very common thing in healthcare. Just giving them those tools to make sure that they know how to take care of themselves to make a better them is the most important thing that we can teach them. And new nurses, especially in nursing school, and I know that's part of the new curriculum they've been really drilling in during nursing schools.
Thanks, Dan. And Liz, of course, you've taught. You've been an adjunct professor. So do you put that into your curriculum in any way, or how do you advise new staff, or what would you say to anyone who's just coming into the field?
I think it's both. I think it definitely has a place in curriculums at the college level or at the educational level, as well as for folks, entering the field in the workforce. And what becomes so important is what are your expectations, right? How are you using supervision? I think Shacarah touched on this, that, where are you setting those boundaries for your day, that you can't be available 24/7, you will burn out quickly, and what should you take personal responsibility and ownership for? Because, there's only so much. I think that's one of the biggest things I see with new staff entering the field. They own it all emotionally, and you can't, right? So you can't take all of that on. So teaching that, and then teaching that, how do you make that transition, right, from work and home and all the stresses that happen to it into that next stage, and how to be really thoughtful and careful about it. So there's deliberate things, it's just also just teaching how to ask for help and do that in a professional work setting, because it might look a bit different, obviously, than in our personal life. So it's like, I need to do a case conference on this particular person because I'm so worried about him because of XYZ. That looks different than how you might ask for help at home. So all of that becomes a part of, I think, I know when I've taught, I've included that as part of, because it also becomes an ethical thing. You have an ethical obligation to take care of your own self. That's just a part of the field so that you can best take care of others. And so just building that into our professional practice.
Excellent. Great answer. I want to follow up, though, Liz, with another question for you from the audience. These are great questions coming in from our viewers. If you have a question, we have a little time left, so throw your question in the comment box. We'll try to address it. But this next one, because, Liz, you have such a long and distinguished tenure in the field, making self-care, the expectation is a very good thing. But are there other things, or any changes rather, being made that can truly make these jobs less stressful? Any success stories that you have? And once again, you've been doing this a long time. So can you point out any success stories or instances where you've implemented these practices and they have made the job less stressful? I know you talked about some of your programs, but any one that you want to highlight in particular?
Absolutely. I would say where we build right in that time to discuss, to consult, a case conference, and that becomes part of that expectation. So for us, when Endeavor became a certified community behavioral health clinic, when we looked at what is needed to truly support the staff to do their jobs, rather than tying them to a thing and you need to see a client every hour upon the hour, where because low revenue drives so much stuff, of backing away from that and saying, hey, wait a minute, let's build in these other things that staff need to be supportive, which is training, which is supervision time, lunch, a full lunch, right? Building all that in, and time to case consult. Those are the things that make that huge turnaround in terms of stress, and then also building in time for self-care.
Excellent. And I want to ask this question for everyone, but I'll start with you, Shacarah. Are conditions for healthcare workers improving? And then I want to ask this in the context of, so we know that we talk about COVID, how much COVID has placed on healthcare workers, but we've also learned a lot in the last couple of years. So would you say they're starting to improve?
I would say, and maybe this is just me being hopeful, or just knowing from my own organization, I would say they are improving slowly, but with such a big, there's so many different organizations in this field. It's like such a big field. I would say it slowly makes sense. So I do think it is improving. I know at our company specifically, I know there is a lot of staff wellness initiatives that have already been started, are continuing to be looked at and focused on to kind of keep that awareness alive of what we need to make the job sustainable. Because a kind of buzzword right now, right, is the great resignation, because people did not have enough time. They didn't have enough space. They didn't have enough flexibility for the world that we live in and the demands that are put on us all the time. So I think that there's an increased awareness, which then has helped to lead to more flexibility in the workspace. So we have an entire virtual team now. So people who do not want to go into the clinic, they don't want to do that 9 to 5 or what have you clinic work every day, they can be on the virtual team. We work to be really flexible with hours and scheduling and not having such a rigid idea in our minds of what healthcare has to look like in our field, because it can look a lot of different ways for many different people. And we can still do our jobs. We can still serve our clients in the population and allow for flexibility to staff in order to allow them to feel like this job is sustainable. So I think it is just, again, we keep going back to intention. And so it's about intentional action. And we have to be able to do that as a company.
Thank you. Dan, how about you? Are things improving, do you think, for healthcare workers?
Well, in a lot of ways, like you guys have all said, that COVID's really taught us a lot of things. I know as a nurse manager here at New Directions, we're ready for any type of COVID pandemic that could happen again. We're ready for any type of pandemic in general that could happen. The preparedness ability for companies now is astronomical. You kind of have that ability to understand what you need, how you're going to need it, and how to do it. As for everything that goes along with COVID and the fact that everything's kind of starting to slow down a little bit, again, probably being hopeful, but everything is kind of coming to a little bit of a head. There's that light at the end of the tunnel that you can kind of see, which is not only going to help out with the caseloads of patients to nurses and patients to social workers, but it's also going to help out with getting back to normal and getting that fatigue and the compassion fatigue and everything kind of back down as well. I can see that starting already in the hospitals and where I'm working everywhere.
Excellent. How about you, Liz? What do you think? Are things getting better?
I would say it's going in the right direction, but I think we have a ways to go yet. And I still see too many healthcare workers with because of the short staffing. So they have caseloads that I think are too high or shifts that are too many. I think between school loans and some people trying to add 2 and 3 jobs on because of reimbursement and salaries. So I think there's increased awareness. There's some budgetary commitments, which is a wonderful thing. Let's hope that all follows through so that people aren't trying to do the work of 2 or 3 people.
Yeah, absolutely.
Shacarah, I want to ask you this question in terms of what message would you give to those working in the healthcare field as it relates to mental health? What are some of the tips, I guess you would call them?
Yeah, I mean, I think the biggest thing that I could say for us working in this field is to take care of yourself, please. Demand that your needs be met from your employer. Do not be afraid to advocate for yourself. Do not be afraid to have those conversations with your peers, with your supervisors, across companies. I think that there is a huge deficit sometimes in the relationship between different organizations. And I think that can definitely be improved. That connection, that networking, I think is very important. We are all working towards the same goal. And so if we can expand the support that we have, I think we'll all be better off, especially when it comes to really advocating for big changes, right? Like Liz kind of started to make mention of, is that we're improving, but we have a long ways to go. And I think that if we can all support each other in that, because we all want the same thing, we're going to make a lot more headway on the changes that truly need to be made. Something that we say here, it's a big thing on the team I was on before, and really kind of incorporating it into my current team now, is that we have to protect our peace. And if we're not able to do that, we're not going to be able to continue to do the really hard work and the really hard advocacy that we need to do. So that's what I would say. Take care of yourself, demand what you need, set boundaries, because we have a hard job and that shouldn't continue to be overlooked.
Got a real quick last question here from the audience we're going to address. So, Liz, if a person has anxiety on a job interview, but they have good job experience, how would they handle it?
If they have anxiety, I think really, like anything else with anxiety, I would visualize it before you went on the job interview to keep your mind on what is it that you're most trying to convey to the interviewer. I would use the techniques of really just that really like whole body breathing, making sure that you're kind of focusing externally on those skills and what you have to bring, because it makes it so much easier, right? When you're thinking about that other person that you're communicating with and making sure that they hear what you were trying to present, because it's just so important. But, interviewing is an anxiety inducing event, right? Anyways, it's always so hard because you feel so I always think anything that's making me anxious about, like, this kid is anxious, we're on live camera and TV and all this kind of stuff. So, but you think about more that other person. Am I making sense? Are you hearing me? How can I make sure that I'm answering the questions or giving you the information that you'd like to have? And that typically helps.
That's excellent. I have to share one little cool piece of advice I got from a grad professor in college, in graduate school. He said, "Be the kind of person that you want to sit down and have a cup of coffee with." Mm-hmm. Very simple. Just be yourself. Be casual. I know it's not easy. So I just want to give you all an opportunity to make some last remarks on our topic today. So let's start off with Dan. Any last comments you want to share for the audience?
Just thanks for having me. It was a pleasure. We're going to keep going and keep going strong in the healthcare world. And the more people that we can get involved and get into the healthcare world, and the better we can educate them on the stressing fatigue that we can have, the better. So just a big thanks to having me on today.
Thank you, Dan. And how about you, Shacarah? How about you? Any last minute comments?
Yeah, I want to thank all of you too. I want to thank the other panelists as well. I think this is a really great dialogue. I think more dialogues like this need to happen to be able to conversate about really important topics. And I would say to everybody listening, if you get nothing else from today, I hope that you are kind of walking away knowing that you have more power than maybe you thought you did before. I think we very much underestimate the power that we have to make changes and to advocate for what we need as healthcare workers. We don't have to put ourselves last or behind everybody else. We can take care of ourselves and still do our job. So kind of walking forward together, I hope, to make the changes that we need to all make.
Wonderful. And how about you, Liz?
I think I would say, well, thank you for being here. What an honor and a pleasure. And I would just remind everyone again that we have to take care of our own needs too. And the HALT method, which is don't get too hungry, angry, lonely, or tired. Those are our basic things. Keep that in mind for yourself and your family and your loved ones and those you work with, and it'll go a long way.
Thank you. I just have to say, this has been a great discussion. A lot of great takeaways. Of course, one of the big things I think we're hearing from everyone is the idea of self-care. Of course, self-care these days has almost become a cliche statement, right? And you hear this, oh, self-care, you see it on TV, you hear it all over the place. But the reality is we do need to take care of ourselves, especially those who are working in the healthcare field, because of the added stress, added demands that are on them. And if they're not taking care of themselves, they can't take care of anybody else. And that goes in our professional lives, in our personal lives, and elsewhere. And also the idea of understanding that when it gets to be too much, reach out for help and know that help is available. I think sometimes those work in the healthcare field feel that they can't do that, like was said, for the fear of stigma. We're talking a lot about stigma, or for the fear that they may not be able to have anyone who really understands what it's like. Those resources are available. So please know that it's something that you can do. So I just want to stress that for all of you who are watching. So as a reminder to our audience, we need you to take the pledge on stigma by going to our website, letstalkstigma.org. If your organization would like to join us in our cause, there's information on the website under the members tab. Together, we can all make this happen. So once again, I'd like to thank our panelists, Liz Mauro, Shacarah Henry, and Dan Nelson. I'd also like to thank the folks behind the scenes, Mike Telesco from Telesco Creative Group, for all of his work and technical support, Matt Smith, who is the chair of the Anti-Stigma Outreach Committee, Harold Doggett from the Mental Health Advocates of West New York, and Karen Karashevsky from KKPR Buffalo, for their support as well. Be sure to tune into our next Facebook Live on April 20th, when we'll be, actually, I think that's April 19th, let me correct that, and we'll be focusing on the state of stigma, understanding mental health challenges within the LGBTQ plus community. So on behalf of the Erie County Anti-Stigma Coalition, until next time, I'm your host, Karl Shallowhorn. Be well.